ready to head home with your beautiful new baby boy?
Yes, I'm very, very ready.
That's great to hear. Are you guys excited to go home and meet Big Brother, or has Big Brother already come to visit?
Big Brother came last night.
Aw, how'd it go?
It went well. He's excited.
That's good to hear. So I just have a couple things to talk to you about before you leave. But before we get started, how are you feeling?
Good. Tired.
I'm sure. I'm sorry. Can't help you with that. How is your bleeding going?
I am bleeding, but not too much. But I don't really know,
That's okay. Yeah. It's gonna look kind of bright red for now, which is normal, and then it's gonna kind of lighten up and kind of turn same thing that you would see after your period. And then for now, just monitor it. Make sure that there isn't too many clots and that the bleeding isn't too heavy. If you soak more than one pad in 15 minutes, let us know. But otherwise, it should kind of be pretty much on par with your period, but a little bit heavier.
Okay.
Okay. And did you have a normal birth or a C-section?
Normal birth.
Normal birth?
Yes.
Okay. For that, you can go ahead and use some Tux pads. We have some. I'm pretty sure that you've already used them. But they help with the burning sensation, and you can use them to help also calm the swelling down on your perineum area and even in your anus. If you have any hemorrhoids.
Yeah. Okay.
You can also use warm water in a peri bottle. That kind of helps get rid of the stinging sensation. One of the tricks is to kind of use it as you're peeing too. It gets rid of that burning, and you can and it helps you kind of go too. So that's what that's for. You should avoid using tissues, especially with everything that's going on down there. But if you do have to, go ahead and use a padding motion and don't wipe.
Okay.
And if you do, just make sure you're going front to back and not the other way around. And just use normal soap, mild soap, no fragrance, warm water, and you should be good. And use a semi-tight, not too tight, semi-tight underwear, and brief to kind of hold everything in. If you're using those Tux pads and everything, the witch hazel pads to help. Does that sound good?
Yeah, I think you gave me a stack of the mesh panties. I'll just put them in there so it's not too tight and it stays in place.
Sounds good. And for your breasts, just make sure that and you're inspecting them ahead of time before feeding the baby. Make sure that they're not cracked or dry, and you can don't wear any tight bras or anything with wires because that also restricts you. Make sure that you're not putting any fragrance on there, especially if you're planning on breastfeeding. Are you planning on doing so?
Yes, I'm planning on breastfeeding.
Okay, we'll talk about it in just a few minutes. Just a couple more things I have to do more with you. For any medications that you're taking, make sure that you talk to your doctor ahead of time. Okay with the doctor, some of it can get to the baby, and some of it might affect your breast milk. So before you do anything, I know it's allergy season, just a heads up. Most allergy meds will also kind of dry up your milk, so take that into consideration.
Okay.
And make sure to clear it off with your doctor first, okay? And how are you feeling with getting up and moving? I know that you have 2 kids.
Yeah, I'm getting up fine, able to walk fine. I just feel a little bit tired.
Okay.
Not weakness, but just being a little fatigued.
I mean, you just gave birth, so that's normal and expected. Make sure that you are taking it easy on yourself. Don't overexert yourself. When you are getting up from bed or a couch or anything, make sure you take it slow. If you feel a bit dizzy, make sure you sit right back down. And then try again. Make sure to call someone, have someone help you. Just make sure that you're not overexerting yourself and then fainting on us.
Okay.
Sounds good?
Yeah.
Okay, any questions so far?
No.
Okay. Driving, especially, we're going to touch back on the meds. If you're taking any of those heavy meds, I know that we're giving you some right now, so you get home for, say, the next week or so, make sure that you're not driving on your own. Have someone take you to your doctor appointments.
I can't drive on my opioids?
No, especially if you're taking some hydrocodone, if you're taking any heavy pain meds.
Okay.
Until you kind of wean off of those, don't drive while taking those because they can cause some mental impairment. And then you have a car seat, I'm going to assume?
Yes.
Okay, has it already been properly fitted and put in the car?
Yes, I went to the fire department and they put it in for me.
Okay, perfect. The baby is going to be rear facing, I'm assuming, right?
Yes.
Okay, that's the correct way. Just making sure that you have everything ready to go. Any questions about the baby in the car?
No.
No? Okay, no, that's good.
I just know to strap the top and then I'm good.
No, I'm sorry. Make sure to strap the top and the bottom.
Okay.
The top is usually made out of plastic, so in an accident that is likely to break off. But do make sure that the top is also put at the baby's chest level so that it doesn't hurt him in the event of an accident.
Okay.
Okay, sounds good. Let's see, what else do we need to do? We do need to talk about infections. If you have a fever that's consistent, not going away, if you see any redness, swelling, any discharge with a nasty smell, please let us know because that could mean that there's an infection going on. Does that sound okay? Sorry. And then we have to talk about this, and I know it might not be the funnest thing to talk about, but your hormones are crashing down, and I know that you're gonna probably feel overwhelmed, especially with 2 kids right now. That's all normal. It could lead to baby blues where you're just crying, and you sometimes feel like there's no reason for it. That's okay. That's all expected. You more than likely have a reason for crying, so don't take it too harsh on yourself. But we also want to monitor that and make sure that your spouse or whoever's at home with you and is helping you is also monitoring you. Make sure that it doesn't turn into a full-blown postpartum depression, and if it does, to kind of make sure that you're not thinking of harming the baby, thinking of harming yourself, and if you do, please reach out to us and we can help you. Nothing for you to feel bad about or feel like you are doing anything wrong. This could be a normal side effect of pregnancy and labor and delivery, so just make sure that you or your spouse call your doctor as soon as possible. Do you have your follow-up appointment scheduled?
Yes.
Yes?
Yeah.
When?
I think it's in 2 days.
No, that would be the baby's appointment.
Oh.
Your
Okay.
follow-up appointment should be 4 to 6 weeks from now, so make sure to schedule that with your OB.
Okay, so no, I don't have that scheduled.
Yes, that needs to be scheduled. Then they're just gonna make sure that everything is healed properly, that your uterus has gone back to the way that it needs to, that there's nothing going on that shouldn't be.
Okay.
So make sure you get that scheduled, please. And if anything comes up, if you have excessive bleeding, like I said, if you're bleeding through a pad faster than say 15 minutes and multiple times throughout a day, or if you feel like you have an infection started, you'll know, please call your doctor right away. That's not something to wait till 6 months later.
Okay, so like with the bleeding, how long will I bleed for? Like how many weeks?
Some women can go up those full 6 weeks. Most
okay.
women usually will go around like 3 to 4 weeks and they'll start to taper off. So it is longer than your normal period, and it is kind of similar to like a light consistent period.
Okay, but just
Okay.
longer. So I don't need to
Yes.
call if I'm bleeding at
2.
4 weeks
No.
if it's not like a large amount. The pad
No.
in 15 minutes. Okay.
No. Okay, any questions? Okay, we're gonna talk about your lovely son for a bit. You mentioned that you're gonna be breastfeeding him, right? Okay. It is the recommended way of feeding, especially for the first 6 months because of the antibodies in your milk. And have you been breastfeeding him here at the hospital?
Yes.
Okay, so he's got the benefits of the colostrum. He's been getting that thicker milk that you've had. It is going to transition into like transitional milk in a couple more days, and then after that it's going to turn into your full like hind milk, which is the more fatty milk.
Okay.
So he'll be getting that. And when you do feed the baby, make sure that you feed from both sides and that you alternate and that you give him enough time on each side of the breast so that he gets the beginning of the milk, which is usually kind of like watery. It's more protein rich, versus the second half, which is more fat rich milk. That way.
Okay.
So if you feel like you're feeding him but he's not gaining weight, just make sure you're feeding him long enough on the breast so that he's getting the fatty milk too and not just the protein rich milk.
Okay.
Sounds good. And if you do decide to bottle feed, that's okay. You can do so. Just don't feed him as much. His stomach is smaller, and with bottle feeding, they tend to take less than breast milk. And you feed less often with bottle feeding. So if you're breastfeeding him, you do have to make sure to wake up to feed him every 2 to 3 hours during the day. and 3 to 4 hours at night, and you do have to wake him up. I know it's gonna be hard. I know that you're gonna want to sleep, but you do have to force them awake because they don't recognize the fact that they're hungry. So,
how long am I gonna have to wake him up for?
He'll eventually start to
Okay.
self-adjust as he gets older, but for the first few months it has to be every 2 to 3 hours during the day and every 3 to 4 hours at night.
Okay.
And as he gets older, he'll start breastfeeding more so and longer, so you're able to stretch all the time just between those feedings.
Okay.
Okay. And then have you had him showered here at the hospital or not yet?
Not yet. I'm gonna wait till we get home for that.
Okay. And are you gonna have him circumcised or not?
Yeah.
Okay, sounds great. So just a couple things to take into consideration. Keep the circumcision area dry all the time, clean as much as possible with just water and soap, and then lightly put the diaper on. Make sure that it's folded over so that it's not bothering his umbilical cord on the top, and that it's not too tight on the bottom. And then when you shower him, we don't recommend immersing him in water, but you can. And then just make sure the most important thing is that it's dry. And then you can put some petroleum jelly on his penis to make sure that that doesn't bother him in the diaper. And make sure that you bathe him, you clean him, and especially the folds. We know that babies are nice and chunky, but they have all these folds. Make sure that those are all dry afterwards.
Okay.
And the water temperature needs to be at 100.4. Slightly above wouldn't be good, but slightly under would be fine. That way the baby is comfortable in the water. You can get one of those like little thermometers to just put in the water, and he should be good to go. And then I would avoid bathing the baby after he's just fed, so that you're not kind of like moving him around and everything, and then he'll throw up on you.
Oh yeah.
So, any other questions right now?
No.
Okay, so after the shower, we want to keep our baby warm. How are you planning on dressing him? Do you put a lot of like blankets on him during the day, or what do you do?
I was normally just gonna do like a onesie, or like if I'm holding him, a blanket. Like
Okay.
not like a ton of clothes. I just don't want him to get too hot. But I also do like a lot of blankets.
Okay, no blankets in the bed, so I would suggest one of those like zip up blankets for the baby.
Oh, okay.
And then I usually go by like one extra layer more than you.
Okay.
They don't regulate their temperature too well right now, so you can always just check their temperature by taking their temperature underneath their arm to see where he's at. Between 97.4 and 99 is usually like a good range to be in.
Okay.
But we don't want him overheating, and at the same time we don't want him too cold, because you really can't tell you if he's overeating or if he's too cold.
Okay.
Sounds good. And then just for sleeping, like we mentioned, is he gonna be sleeping in bed with you or in his own place?
Yeah, he's gonna be sleeping in bed with me and my husband with blankets. I got him a really cute lovey, and like family members have been knitting a bunch of blankets that I'm just gonna
That sounds amazing, but we also do have this thing called SIDS, which is sudden infant death syndrome, and we are trying to avoid that. It really doesn't have much of a known cause, other than we know that sometimes they either don't wake up, like something's wrong in their brain and it kind of doesn't wake them up, or they're taking in too much carbon dioxide. And we know that when they are like really warm, it can lead to it, and we know that putting anything in the bed with the baby can also cause them to suffocate.
Okay.
So unfortunately, baby should be sleeping in his own little place in the same room with you, but in his own little bassinet on a hard surface, no pillows, no blankets, and no bumpers.
Okay.
Okay, sounds good. Any questions about that? I know that you're excited for all those blankets, and they can be used, but under your supervision during the day.
Okay.
Okay. Okay, we're gonna just talk about a few more things. If you notice that your baby's a little bit yellow, that's normal. It's called jaundice in baby, and it's just a yellow tint to their skin. It's because their red blood cells have bilirubin in it, and they haven't been able to get rid of it yet.
Okay.
As they eat, the more they eat and drink, the more their body's gonna excrete this bilirubin, and the more that their color will go back to being normal. You can also put them in the sunlight in the beginning of the day. That vitamin D also kind of helps get things going.
Okay, so what can I do about that?
There's nothing for you to do right now. If in like 2 weeks it doesn't clear up, then let us know. We'll test their levels and we'll see if there's anything going on with their liver. But currently it's nothing to be worried about. It's normal to see in babies at this age.
Okay.
And you've mentioned that you're circumcising him. Just keep it clean with water. We talked about circumcision care. We talked about circumcision care. We've already talked about their car seat safety. The only other few things then is basics. Make sure you're washing your hands before touching the baby. Make sure everyone's washing their hands. Anyone that's sick, keep away from the baby. Their immunity hasn't built up. We don't want them catching any viruses or illnesses or having any infections of any sort.
Okay.
And then if you do see that the baby's trying to get like some fluid out or some mucus out and they're struggling, you can help them. You can use a bulb syringe. Start with their mouth before their nose though. That makes sure that they're not gonna choke when you go clean out their nose, so that you already cleaned out their mouth and there's nothing that they can go like and then like choke on after that.
Okay.
You okay? Do you know how to tell if your baby isn't feeling well?
Kind of. Like crying and that sort of thing, but
yeah, but if they have an infection, if they're sick, they're not gonna show it the same way that a adult would or a child would. So just make sure that they're eating really well, that there isn't increased sleepiness. I know the babies sleep a lot, but you'll kind of be able to tell where they cannot wake up even for like a half an hour at a time.
Okay.
They might get a slight fever, but if it's like under like the first month and the baby has a fever, that's a problem. Let your doctor know. If they're kind of cold, they might have a rash, they're just incredibly like fussy and not falling asleep, or they're just not resting, let us know. We'll check them out. There might be something, they might be getting sick and that needs to be taken care of right away. And you should seek medical attention if the baby develops a fever under 12 weeks, like I just said. Or if they're cyanotic, which usually means that they turn blue around their mouth and around their nose. That means they're not breathing well. That's a medical emergency. Please call right away. Take him into an urgent care in ER. If there's any bleeding that isn't controlled, also make sure to take him in right away. Or if you feel that he's crying in a really unusual way that's related to pain, take him in to be seen. Other than that, just make sure that he goes to his follow-up appointment in a few days with the doctor. You've already chosen your pediatrician, I'm assuming?
Yes, and I think that's in 2 days.
Okay, 2 days sounds perfect. And then after that, they're gonna follow a schedule, usually every month, and then after that it becomes every 6 months, and as they get older, it becomes once a year. But the doctor will give you all of that information. I know that this is a lot of info. I don't want you to feel overwhelmed. Are there any questions?
No.
No? Okay. I'm excited for you and this new baby. And hopefully Big Brother takes to this well, and hopefully Dad is excited since he has 2 boys.
Yeah.
Okay. Okay, perfect. Congrats to you once again.
Okay, thank you.